The Health Secretary Sajid Javid has promised a radical new approach to dealing with a debilitating illness, ME, or some know it, chronic fatigue syndrome. He says those living with the condition need better care and support. Well, our reporter Bob Cooper has been following the stories here with me now. Bob, what do we know about the illness and how it's treated here?
Well, we think maybe about 250,000 people in the UK suffer from this disease. Hundreds are being treated here in our region. We don't know exactly what causes it, but it usually follows some kind of trigger like an infection, or in some cases, as in the case of someone I've been speaking to, a response to a vaccine. Here's Stephen Hocking from Keswick with his personal take.
15 months ago, I was working full-time for the NHS as a radiographer. My spare time was filled with as much cycling and fell walking as I could squeeze in. I was a happy and healthy husband and father with a bright future and lots to look forward to. My life, however, changed overnight. I can now barely remember what it was like to be that person. I have since been diagnosed with a condition called Myalgic Encephalomyelitis, commonly known as chronic fatigue syndrome. Instead of my usual abundant energy, I now get out of breath just walking up the stairs. At first, I struggled to understand what was happening to me, so I tried to push through my symptoms. This made me worse, much worse. I now find it difficult to concentrate, and just a simple conversation can exhaust me to the point where I have to lie down in a dark room. My body no longer regulates itself properly, and simply standing up causes my heart rate to race like I'm running a marathon. My symptoms are so bad that I've lost my job and am housebound except for the occasional hospital appointment. Some days I'm unable to get out of bed, and it's not unusual for me to sleep up to 16 hours a day. It's like your battery only ever reaches 5%, no matter how long you put it on charge. ME is much more than being tired. It feels like a struggle just to exist some days. Despite the devastating effect it has had on my life, I have received no medical treatment from the NHS. When I was finally diagnosed, nobody explained what it was or how it would affect my life. The only treatment option was a clinic led by a health psychologist, when ME is not, despite misconceptions, a psychological issue. Doctors are taught very little about our condition, so we're often written off as being lazy or as suffering from a mental health condition. More research is desperately needed. It's time the medical system tackled this devastating disease.
Bob, obviously we heard Stephen's personal story there. What does his local health trust say?
Well, the North Cumbria Integrated Care Trust says they'd be happy to meet with Stephen to discuss treatment options. They say that their service is made up of psychological therapists, physiotherapists, occupational therapists and living well coaches, and that a rehabilitative approach involving psychological therapies and physiotherapy has been shown to have a positive impact. They say they'll always take the opportunity to listen to patient feedback and continuously strive to improve patient experience.
Now, these questions, though, about patient care and, of course, research into this, they've been around for a long time, haven't they? Yeah,
they have, and they've moved higher up the agenda recently because of a change to the official guidelines last year, which means that trusts are no longer advised to offer some previously quite controversial therapies. And Sajid Javid, the Health Secretary, has now set out his intention to really overhaul things, support more research and set out a cross-government plan to deal with the issue.
And you've been looking into how some of our local NHS trusts are dealing with this?
Yeah, that's right. I want to look into dropout rates for specialist services. So I asked all of our local trusts how many patients who'd been referred since the start of last year had stopped using the services by December. Now, in some areas, it was between a third and a half. Now, the trusts have told me, of course, in some cases, patients will just be getting better and patients can go back to those services if they need to. However, there is a concern, given it's a long-term illness, that maybe some of these patients are just not being helped by these services.
Bob, thank you very much. Well, let's talk now to Sonya Chowdhury, who's Chief Executive of Action for ME, which campaigns for better treatment and indeed for better research into the condition. Sonya Chowdhury, you heard those figures, you've heard Stephen's. Obviously, he didn't feel the treatment available to him was appropriate. What do you make of what that tells us at the moment about how patients with ME are being treated?
Yeah, I think it's very difficult to understand those figures specifically without seeing the detail behind them. But what we do know from what we're told at Action for ME is that people find services inaccessible. Some are just so severely affected that they can't access the services, or distance is an issue. We also know that some services are still not meeting the revised NICE guideline, which sets out what should and shouldn't be offered by services. And so I would be curious to understand what is being offered to people like Stephen in your area.
You've been part of this process of reviewing and trying to improve things with Sajid Javid, the Health Secretary. Is there potential there? Do you think that's a serious, a politician really grasping this and driving this forward? Can it change things?
I think it has huge potential to change things. We know that people have been neglected for decades, and having somebody like the Secretary of State and the Department of Health colleagues that are working with him taking ME seriously is critical if we're going to see things change. It's important that we bridge the gap between policy and the lived experience of people like Stephen. The delivery groups are being set up at the moment, and we are expecting to see a delivery plan that will ensure that specialist services will deliver services in line with the NICE guideline.
Now, obviously, long COVID has become obviously a phenomenon of the pandemic, and it has similarities to a lot of ME symptoms. And does that help, the fact that that's there, that might help to promote research?
I think it's none of us would want anybody to suffer in the way that people with ME have suffered. And so it's very sad to see the number of people now experiencing long COVID. And sadly, we could have predicted this as we did when COVID first hit, because most people with ME suffer following a virus. However, which has helped to shine a light on the impact and experiences of people with ME, and a large proportion of people with long COVID have overlapping symptoms. Some don't, but many do. And that, of course, gives us an opportunity to better understand what is happening. And we want to see the money going into long COVID research, which is absolutely critical, to also be used to better understand post-viral diseases like ME.
Sonya Chowdhury, thank you very much. Now, many people are cutting